Okay, good evening, everyone. We are ready to begin. This evening we have an exciting meeting for you, and I am sure you are going to enjoy it. I am Dr. Monique Mitchell. I'm your host for this meeting this evening, and I want to say Happy New Year to everyone. We have made it into the new year, and we are excited to begin this new year for Feet4Life 242. So I trust that you had a good Christmas. It feels like we've had so many holidays now. Christmas, Boxing Day, New Year's, and Majority Rule. We've had a lot of holidays here in the Bahamas, and I'm sure I enjoyed them, and I'm sure everyone else enjoyed them as well. But we are energized and excited to begin the new year and to take on 2024. I hope that you are ready to learn more about how you can take care of your feet and what it is that you can do to save them, because that is what we're going to be talking about tonight. You are in the right place. Thank you so much for coming. Thank you for being here. Thank you for the support throughout the year and into the new year already. I know that you will receive a lot of information and skills that you can use to save your leg and save your life. You can share them with family members or persons you work with, maybe to help them to improve their overall health, maybe to prevent diabetes or even help to manage diabetes better. So we're here and we're very happy that you are here. And we're going to make sure that you receive all that you need. So you can see that I'm pinch hitting today because I'm alone today. So I'm trying to admit as well as talk. So but I'm trying to pay attention. Okay. So please remember to mute your mics and make sure that you put your questions in the chat. We usually will answer those questions at the end of our session. And usually we have a lot of questions, and so we want to make sure that we do not miss any of them. So make sure that you put your questions in the chat. We are again, oh, that reminds me, I didn't turn on the Facebook. So live on Facebook. All of these things you have to remember. All right. So good night again, and welcome to our Facebook audience as well. We're here at Feet4Life 242, and we're very happy that you are here. I'll continue. Our YouTube channel is up and running, and we've been uploading all of our videos. I think the last video we're still to upload, we had a little technical difficulties, but I think we got it sorted out. So that video will be uploaded probably tomorrow along with this one. So we're very happy that you're here, and we're happy that you're able to have access to all of this information even after the meeting is done. So we're live again tonight. And the video, like I say, will be posted tomorrow. Thank you for inviting your friends and sharing the link with them. And usually we have a good turnout, and we're looking forward to the night as well. We like to know where you're visiting with us from. So just put in the chat where you're joining the meeting from so that we can recognize you. We know we have our usuals from New Providence and various islands throughout the Bahamas. We also have persons from the United States as our speaker and others, and then also parts of the Caribbean. So we want to just recognize where you're joining us from. So let's jump right in and get started. We're going to begin with a short devotion and a prayer by our devotional speaker, Mr. Elder Louis Roll. He is an elder at the Hillview Seventh-day Adventist Church, and he will give us a short devotion and a prayer to get us started. So you can go ahead, Elder Roll.
Thank you, Sister Monique, Dr. Monique, and good evening to everyone. As you said, we're talking about diabetes, and I was asked to give a devotion in connection with diabetes and talking about foot health. So I just took off my tennis just now, and it's amazing how comfortable my feet feel. I feel like the blood is circulating. So I want to say thank you for this invitation to be with you tonight and to share what the Lord has laid on my heart. When I think about diabetes, I do remember we had a cousin who was at a crusade some time ago, and she sat under the tent, and she was unaware that the ants were biting her, and that was a serious condition, or brought on a serious condition for her. And I do have a very good friend, a big brother, who is also a diabetic. And more we're hearing about diabetes and how it affects all of us. In fact, I understand from some research that about 4 million people worldwide suffer from diabetes, and that number could be more or less, and that brings on different conditions. However, before we begin, let us bow for prayer. Our Father in heaven, we thank you. We thank you that you're the God who made all of us, and you know about each one of us. We're all special in your eyes, whatever conditions we have, oh God, we're just grateful that you're still faithful and you still love us, and you've given us wisdom to manage our diseases, our ailments, and you've given knowledge to help professionals, oh God, as they minister to us. We just want to thank you. Be with my words, and may they find lodging in some heart tonight, in Jesus' name, amen. And so I want to say to you tonight, I don't know, first of all, this is a brand new year, 2024, and New Year's always come with hope and optimism. And I want to say to you, even in your situation, if you're a diabetic or you have relatives who are diabetic, 2024 can be a year of hope and optimism. You can expect to see changes, you can expect to see improvement because God is faithful. He says he will never leave us or forsake us. In Isaiah, he says, I know the plans I have for you. Plans to give you hope and to prosper you. Plans to take you to an expected end. Those are God's words. But you know, the issues that we face in this world, they're a result of sin. Sin came in the Garden of Eden, and sin has plagued us from then until now. And even our diabetes, while in some cases you may not be the perpetrator or you may not be the direct cause of your diabetes, that could be hereditary. But I want you to know that sin and disease are all the same. We have disease because of sin. But our Savior, Jesus Christ, came to live on this earth and to die for us. Jesus came, and his shed blood on Calvary. By faith, when we accept his atoning sacrifice for our sins, we are forgiven and we are bound for heaven. Heaven will be our home when Jesus comes. And that is all predicated on the shed blood of Jesus Christ on Calvary. You cannot do anything to earn salvation. Jesus' blood will purify the sinner. And I want to say to you, that same blood will purify the diabetic. While you may live on this earth and you may have some challenges, you can live with expectation, knowing that when Jesus Christ returns, you're going to have a new body, a new heart. You will have no more diabetes. You don't have to take insulin, the fast acting or the slow acting. You don't have to know your A1C. None of those things will matter to you because the trees of life will be in the garden. The tree of healing will be in the garden. So your body will be constantly renewed, and that lung that you have in your heart to be free from all medication, to be free from the prodding, free from the sticking, that you can eat all those delicious fruits in the garden in heaven, and you don't have to worry about your sugar spiking. or you don't have to worry about fasting, because the blood of Jesus, which cleanses from sin, that same blood, when we accept it by faith, will take us to heaven, and we will live and reign with God eternally. Now, brothers and sisters, in order to get to heaven, you have to trust God. And so that means just how you have to be compliant with your medication, you have to be compliant with the word of God. And I'm not saying that you will be perfect, because none of us are perfect. Sometimes we slip and fall. But as far as possible, by faith, we live studying God's word. We live meditating. We live singing the songs of praises. And God will definitely enrich our lives. And you will find that by doing these things, even your ability to cope with your medication, to cope with the challenges that you face, will increase. God says that you will mount up with wings like eagles. Imagine that. That's what God will do for us. So there will be no need to monitor your glucose in heaven. I want you tonight, friends, to put your hope and trust in God. He should be our first, our best, and our last. So what I practice now every morning before I even put my feet on the floor, as I'm getting up, I'm allowing my thoughts to ascend to heaven and asking God to come into my life and fill me and give me the strength that I need. And then you go on to your devotion. Put God first in everything you do, friends, and He will not fail you. He says, I will never leave you or forsake you. So as you go through this presentation tonight, my prayer is that you will be encouraged. My prayer is that in this new year of 2024, you will rise to higher heights in all of aspects of your life. May God bless you abundantly in all that you do, and may everything you touch under the power of the Holy Spirit turn to gold. Thank you, and may God bless you. Let's pray. Heavenly Father, we're just so grateful that you know all about us. God, you know our condition, you know our heart's desire, but we're grateful that you are faithful and you love each one of us with an everlasting love. We are each the apple of your eye. So, Father, by faith, we stretch our hands to thee and we claim healing from all our diseases, oh God. And we pray that you would give us the discipline we need so that we can be compliant with our medication, compliant with our diet. And Father, may we go and share the good news of salvation and the good news of how we can live a productive life with diabetes, as long as we take our medication, as long as we're compliant with our diet. In Jesus' name I pray. God bless every one of you. Amen.
Amen. Amen. Thank you, Elder Rule. I think that was a wonderful devotion. Thank you for reminding us that, there'll be a time when we can eat all the fruits from the garden and we don't have to worry about our blood sugar spiking. So that's a very good reminder, and that we should trust God and that He will bring us through. Awesome reminder. Thank you, Elder Rule, for that devotional. Now we're going to continue. And we want to say, as we begin our meetings every night, well, every month, we always reflect on the impact that diabetes has on our lives, on the lives of our family, our members, and our friends. So we know that diabetes and foot complications are the most, one of the most common, but also the most feared and the most costly complications of diabetes. When it comes to diabetes, seconds count. So we want to see that every 1.2 seconds, someone develops diabetes. That's somewhere in the world, not only in the Bahamas. Every seconds, someone dies from diabetes. And this one we all know, every 20 seconds, a limb is amputated to diabetes somewhere in the world. But we're also noticing here in the Bahamas that our numbers of complications are also going up. We're seeing them more and more common and in more and more younger and younger persons. So we have to do something. One of the things that we have done is to start this online diabetes resource center for persons who have diabetes or might know someone living with diabetes, that they can get the answers to their questions. They can have contacts with persons, resources that can actually help them to cope with the diabetes and prevent these complications. So we're very, very happy that we're able to provide this service. And we believe that no matter what is going on and what persons have to follow or live through, if we work together, that's the patient, if the family members, the health professionals, if we all work together, this is the only way we can actually improve the person's life who have diabetes. And by working together, we can actually save limbs and save lives. So that is the purpose for us being here today. And we're making sure that all of these persons, all persons that we know who have diabetes, can work and live the life that they would like to have without complications. And so before we begin our presentation, we usually have a take control minute, and we are very excited about our meeting tonight because our speaker is highly qualified, and he's going to do an excellent job just talking about the role of the patient and the importance of the multidisciplinary team, the role of the patient on that team as the center of that team, and to make sure that all our patients or family members actually have the skills and the ability to save their limbs and lives. We've learned a lot about what the other team members do, what the podiatrists do, what the nutritionists do, what all of these other persons do, the orthotists or what they do on the team. But we haven't spent a lot of time on the role of the patient. And so tonight we're going to begin that. And that's going to be a theme for this year, empowering our patients and our persons with diabetes to do their very best to save their limb and their lives. So I am so excited and I can't wait to get started with this presentation. But we have one more minute, take control minute, and we're going to go and do that right now. And then once we get back, I'll do the introduction to our speaker and then we'll get started. So let me get to our video. Sorry. Okay. Can you hear me now? Okay. All right. Sorry, couldn't hear. Okay. Let's do that again.
Meet your feet. Go ahead, say hello. They may be the furthest thing from your mind, but they deserve some attention.
Huh.
Your feet will walk more than 100,000 miles in your lifetime. Enough to circle the globe 4 times. Leonardo da Vinci touted the human foot as a masterpiece of engineering and a work of art.
Bello.
Almost 1/4 of all your bones are in those 2 masterpieces. When running, you can exert forces up to 4 times your body weight with every step. As a woman goes through pregnancy, her feet can expand by a half size or more. Socrates observed,
"When our feet hurt, we hurt all over."
3 out of 4 Americans experience serious foot or ankle problems in their lifetimes. Podiatrists spend up to 7 years in podiatric medical school and residency, focusing all their attention on how to fix those problems. So meet your feet at todayspodiatrist.com and learn more fun facts about your feet. Meet your feet. Go ahead, say hello.
Okay, now we're going to get into the meat of the matter. Our speaker this evening, as you can see, is Dr. Bell. He has been here before, so I pulled up these pictures. I'm sure he's going to be surprised when he see them. So Dr. Bell has an impressive resume, and he's an expert in the area of wound healing and amputation prevention. I'm not going to read his whole resume because we'll be here half of the night. He's the founder and president emeritus of the Save a Leg, Save a Life Foundation, a multidisciplinary nonprofit organization dedicated to reducing lower extremity amputation and improving wound healing. He served as the chief medical officer for Omeza, an evidence-based medical technology company. Dr. Bell was awarded the first humanitarian award by Specialty Hospital in Jacksonville in 2009, and then again at Memorial Hospital, also in Jacksonville, where he lives, in 2018. He's a board-certified wound specialist, having served as board of director on the American Board of Wound Management for 6 years, and he now serve on the board of the American Board of Wound Management Foundation. He has also been elected as fellow to the Royal College of Physicians and Surgeons of Glasgow and is a member of the CLI Global Society. Dr. Bell has published many articles on wound healing and lower extremity amputation prevention and is on the editorial board for the journal Today's Wound Clinic. He's a graduate of Tulane University and Temple University School of Podiatric Medicine. Like you can see from these pictures, Dr. Bell has been to the Bahamas, I think at least twice. He has been very supportive of our efforts here in the Bahamas to prevent lower extremity amputations. And he has visited us, as a matter of fact, I think in 2002, and then again in 2000, and then I think a while before that when we did our lay educators training. So Dr. Bell is very committed to helping us to lower our amputations, and I'm very excited to hear what he has to say tonight, and we're very pleased to have him as our speaker. So help me welcome Dr. Bell, our speaker for this evening. I'm going to stop sharing. Okay.
All right. Thank you for the introduction, Monique. And it's great to be amongst old friends. It's good to see Dr. Horsley. And I don't know if Dr. Farquharson's on the call tonight, but I know there may be some other people that I'm pretty sure that I recognize some of the names too. So really wonderful to see everybody again. Monique, are you able to see my screen?
Not yet. We can see you. We don't see your screen yet.
Okay, let me let's see how we can get that up. Here we go. Share screen. Here we go. I
Just give me a minute. I seem to have lost Dr. Bell. So let me make sure he's still on. Okay, seems like we're having some technical difficulties. Let me contact him and I don't see him. Oh. Okay, he sent a message. Okay, Dr. Bell sent a message. He said his computers decided to run an update just as he was beginning. So give him a few minutes and he'll be right back with us. So I just saw him disappear. So how was your day, Dr. Horsley? You have some exciting news for us. Can you tell us a little bit about that as we're waiting on Dr. Bell?
Well, I was hoping you would ask. One thing for sure, I wanted to encourage your patients and folks that are near you to take their new Remedy Plus to address the #1 cause of, or most common factor, rather, in lower extremity amputation, and that's polyneuropathy. And speaking of polyneuropathy, this book is out called My Toe Can't Go. And I'm going to hit send, and it's available on sale. And what I like about this book, it's about this little girl, Pineapple Ariel, looking at her foot, her grandma's foot, and she goes about saving it. But if people keep their daily log, this is in the back of the book, for every month, you can keep your blood pressure, temperature, pulse, glucose, A1C.
And
So,
foot. And foot.
Yeah, and foot. And take this to the doctor, and the doctor can get a more accurate reading of exactly what's going on in your life, what day, what you're doing, whatever. Because doctors, everyone, when the sugar is 350, 425, it's something they ate on the way in or was last night. But this gives you a day-to-day monthly recording. So it's like a medical children's book. I know a lot of the STEM programs, science, technology, engineering, math, they're gearing towards the ladies, but everyone is a part of STEM. And so this kind of ties in limb salvage, amputation prevention, and it's a nice children's book. And children love it when there's a rug in the house. They can use it as an ice skate, like my grandchildren. They read it, and then I look around and they're skating around the rug, around the room. I said, okay. So at least they're putting it to good use.
So where can they get the book?
I just posted, it's called sales.bookbaby.com.
Okay, awesome.
And I just put in toe or my toe cannot go or can't go. And it'll, what I'm trying to do is to get the book into every child's hands in the school system, maybe age K through 12.
Okay,
And so people can do just what you're doing with your broadcast, what Dr. Bell is doing, and Dr. Danny Johnson. What we're doing is saving these limbs. Dr. Farkinson, Dr. Mesplez, everybody. It's a team approach. And I think if I figured I could reach the children, let them know that there is hope if we can increase the presence of mind for people to know what's going on with a family member or themselves, and obesity. Things have changed in this world. You can't talk about certain people anymore, so it's okay to be obese. It's just fine. Well, it's really not just fine. I have to speak up for the medical community. I know people have their rights to be themselves, but that obesity leads to diabetes, all that red meat. It was nice to hear Elder Roll's prayer. That was really helpful for people to understand that they have to take an effort. They have to use prayer, but they have to do something for themselves to prepare for heaven. And when you get to heaven, you don't want to be missing a toe.
Awesome. Thank you, Dr. Horsley. Dr. Bell is back. I can see him. So wonderful. So Dr. Bell, go ahead, take it away. And Dr. Horsley, at the end, I'm gonna need you to probably post that again so that everybody can have it. I'm having a wonderful idea right now, thinking of what we can do with the children with that book. So we got to chat.
Oh, beautiful, because you're the distributor in the Bahamas. So yeah, I would love to hear your ideas. All right, Dr. Mitchell and Dr. Bell.
Hey, Dr. Horsley, thanks for pinch hitting for me for a couple minutes there. You can't even make this up. I mean, I'm prepared, I'm ready to go, and at that very moment, my computer just shut off on me. So anyway, Dr. Mitchell, Monique, if you would please allow me to share my screen, because I have a message that says I'm not able to share right now. It says host disabled participant screen sharing. Well,
okay, you should be good now.
Can you all see that?
No, we can't see your screen yet. We're just seeing still your video.
Okay, let me get that one more time. How's that?
Awesome, good stuff. We can see it now.
Okay, perfect.
Very good.
Okay, excellent. It's really, Monique, it's just really an honor to always be in your presence and to see, friends now. And going back to the first time I visited the Bahamas, as we were talking a few weeks ago, as we were preparing this, I vividly remember so many parts of my visit. And then when we came down for the Hurricane Dorian relief program too, which ironically enough, we were lucky to get out of Nassau because COVID hit, and in the world as we know changed almost overnight. So, but here we are, and we persevere, and I know I'm amongst kindred spirits in all this. And again, if I haven't met you before, I hope to in the near future. I'm Dr. Desmond Bell. I will say that I've been really following this arc, or my passion in a sense, for roughly 27 years now. I dedicated my professional and really even personal life to amputation prevention. When you see the things that we as podiatrists see, and knowing that we can do better, it's so imperative that we be a resource for each other, and we continue to lift each other up too. It really is heartbreaking though, and we hear a lot of times, or over the past few years anyway, how there are these parallels between diabetics, conditions such as an open wound or peripheral arterial disease, and having parallels in terms of life expectancy and quality of life to all sorts of forms of cancer. And then knowing that probably the only thing that's worse is lung or pancreatic cancer. And so I guess watching my patients over the years, and their struggles, I saw that parallel firsthand too. I think everybody on this call has known somebody or had a loved one who's been affected by cancer, and watching what our patients with diabetes struggle and go through, it really is so similar. It can really be an undignified way to leave this world. Dr. Horsley just mentioned something that's so important, this accepting of, let's say, unhealthy, listen, genetics are one thing, but you can do things to really improve your odds. The point of this is, healthy lifestyle is something to strive for, because if you do have diabetes and you have to go through some of these terrible things that we see and treat, it's not like somebody flips a switch and then you're gone. It's just this downward spiral, and your quality of life just takes a hit. And it's not just you, it's also your loved ones suffer along with you. So we have to do better. And that's really going to be the message for this evening. Save a Leg, Save a Life Foundation, if you're not aware of what we are a nonprofit organization that has been dedicated to reducing unnecessary lower extremity amputations, improving wound healing outcomes, and really trying to improve quality of life of our fellow citizens who are afflicted with diabetes and peripheral arterial disease. So tonight's topic is learning how to become proactive versus reactive. And that's going to be the take-home message. I want to help you understand things that you can do so that you don't become a victim of what I call the amputation lottery. Unfortunately, amputation, even in the United States, it's shocking to know that half the time that it's performed, it's done without any type of vascular testing or really thorough assessment. And the truth is, we have technologies that can make a difference, but those technologies are only useful if you as a patient know what's out there and know how to be your own advocate. So that's what we're going to focus on this evening. And I think this will be an uplifting message more than anything. But we do have to cover some of the not so pleasant things as well. So I have nothing to disclose for this talk this evening. I am the Chief Medical Officer now of a company called Omeza, and I'm based in Florida. So as a diabetic, you can choose to meet it head on, or you can try and hope that things, work out for you. But hope is not a strategy. You can't just wish things away. You've got to be proactive in all this. So if you are a diabetic, you've got to know your risk factors. So the point is, why do some people with diabetes, though, suffer so many complications, including things like amputations? Why is this? Well, the disease is terrible. We know that, but it's not just because of the diabetes itself. It's because maybe people don't really understand how all these comorbidities or things associated with diabetes work in conjunction with each other. So you got to understand that. It's, the people who are at risk a lot of times don't understand how they can even prevent tragedies such as amputation, heart attack, stroke, because they are all related. I know my colleagues on this call will probably agree with this statement. We've been in that situation where we have somebody who looks like this photo on the screen here. You know, the toe is basically gangrenous. And you say to yourself, why didn't this person come in sooner? Why did they wait so long? Well, more than likely, they didn't really understand what was going on in their body. Sometimes they choose to ignore it. Sometimes patients will hide things from you as well, and kind of wish that things are going to get better. But unfortunately, nothing magical happens. So how does this all begin? So let's focus on arterial conditions here. So I mentioned cardiovascular disease is one of the major comorbidities of diabetes, but it's the #1 cause of death among diabetics, and that's primarily heart related. But it goes well beyond the heart. The aorta is the largest artery in the body, and as it branches out from the heart, it gets small. The arteries become smaller and smaller, kind of like branches on a tree. The further away you go from the trunk or the base, the smaller they get. So those blocked arteries, though, over time, if they fill up with plaque, they're going to cut off blood flow, not only to the heart vessels, but to where any number of places in the body where blockages can occur. So again, the further away from your heart, the smaller the arteries become. And those smaller arteries are more susceptible to blockage. So again, thinking in terms further away from the core of your body, those small vessels tend to be down on the foot, can be in the fingertips, they can be in the kidneys. And so these are, just some of the places that we have to look in terms of where diabetes can be causing its problem. But if you look at some of the warning signs too, and how this all ties together, the name of the organization, Save a Leg, Save a Life, is not only referring to reducing unnecessary amputations, but it is connecting the dots between things like heart attack, stroke, and amputation. So all these things are connected. So how do you know if you've got peripheral arterial disease or vascular disease of some sort? Well, besides something obvious such as a heart attack or stroke, you may have symptoms. You could have things such as fatigue, dizziness, shortness of breath where you didn't have it before, chest pain, which you should never really ignore, lower back pain, for men, erectile dysfunction, again, smaller vessels, and even things such as symptoms that could be mistaken for peripheral neuropathy if you're diabetic, which, neuropathy, while we're talking about it, it's kind of a wastebasket term. It can present any number of ways: burning, numbness, tingling, sharp shooting pain, dull achy pains, feeling of fullness, but also that complete absence of the ability to feel anything. And in more severe cases, a lot of times it can go up as like below the knee level. But those symptoms are very, very similar to what can happen with peripheral arterial disease too. So if you have something in your feet, such as numbness, tingling, especially the cold feeling, it may not necessarily be neuropathy. It could actually be advanced peripheral arterial disease. So be on the lookout for that. Arteries are blocked, blood can't reach where it needs to go, and that targeted tissue dies from lack of oxygen. So that's called ischemia. And this can happen in the heart. You may have lesser symptoms such as angina. You may go into a full-blown heart attack or myocardial infarction. If it's in the brain, you may have the transient ischemic attack. You may have a stroke, or you may have lower extremity issues such as peripheral arterial disease or advanced critical limb ischemia, CLI. And I like to call that a foot attack. Think about this. If somebody presented or somebody developed a cold foot with pain and looking something like you see on that screen right now, and they presented to a hospital, there's a chance that they might be sent home. And the whole point is, if somebody showed up to a hospital with chest pain, jaw pain, all the classic symptoms of a heart attack, they'd be admitted right away. But a lot of times people with diabetes will show symptoms in their feet or one foot in particular, maybe not as severe as looking at this, but it's mistaken for, let's say, an infection or cellulitis. The foot may actually look red. And so what happens, maybe emergency room doctor will send the patient home with some antibiotics and things get worse. So, the point is that when you see a foot that's starting to get cold or one lower extremity is sort of a different color than the other, and it's accompanied by some of the symptoms that we mentioned, that's a medical emergency and you can't mess around. We always say time is tissue. The longer you wait, the likelihood that something bad will happen. So that blood reaching or not reaching the foot can lead to ultimately gangrene or the need for amputation or even death. So let's talk a little bit about peripheral arterial disease a little bit more specifically too. So one of the problems with PAD is it's something that many people with diabetes have. In fact, I will even make this statement. As I would review a patient's chart for the first time and I'd look at their medical history, and if I saw that they had a history of coronary disease or a prior heart attack, I would make the assumption that they also had peripheral arterial disease. It's that closely tied together. But anyway, the problem is that the symptoms are sometimes not recognized at all. And if they are, they may not be taken seriously. But the point is that they can also be become the patient's normal kind of, let's say, level of what they're experiencing. So one of the things that you look for when somebody's got early PAD is a symptom called claudication. Now, intermittent claudication is a term that refers to pain that happens in the lower extremity, usually in the calf muscle area in the leg, but it can also happen in the buttocks area. And it occurs during walking and some type of exertion, such as walking, but it's usually at the same distance. And the pain becomes so significant that the person has to stop walking, they have to take a rest, and then the pain will subside. But when they start walking again, those symptoms will return. So if you ever experience something like that, especially in one leg in particular, that's a warning sign right there. So you don't want to mess around. You don't want to delay seeking treatment. And again, that pain subsides. Now, there's other things that can kind of mimic this condition, but for the discussion this evening, let's just talk about claudication in general and assume that if it is something that you've experienced, again, please don't ignore the symptoms, just the way you wouldn't ignore chest pains. This is an example of critical limb ischemia. Now, if you look at this foot, you see the toes are kind of dusky, turning purple. This is an example of peripheral arterial disease that has now progressed to that critical stage. Individuals who are experiencing this type of symptom, these are the people that you may know or you may have experienced this yourself. All of a sudden you find yourself needing to sleep with your foot dangling off the side of the bed or even sleep sitting up. People do these things without even thinking about it. Excuse me. And what they're doing is actually listening to their body. What's happening is if they're trying to lay flat in their bed, their heart's not able to pump blood down to their extremity as efficiently as it should. So it starts to become more painful to the legs and the feet. So what happens is these individuals tend to dangle their foot off the side of the bed. And what they're doing is allowing gravity to help pull blood down to the extremity a little bit more easily. And again, this is a physical example of what a foot attack might look like. And that foot becomes dusky, cold, and very painful too. And I mentioned earlier that this is really a medical emergency that requires immediate intervention. Now, the good thing is if you catch something like this and you seek treatment, there's a real good chance that there can be some type of intervention that can be done. In the olden days, they would either amputate or maybe look to do a bypass surgery of the lower extremity, which is a pretty brutal surgery. But nowadays we have the abilities to do things like angioplasties. the things that are done for heart to open up coronary vessels, things such as angioplasties or stents. We're doing those type of things in the lower extremities too. So people that were once not a candidate for anything but an amputation now have gotten a new lease on life. So this has become more and more accepted over the past 20 years. So here's some of the good news. And this, what you see on the screen now are some examples of what stents look like. They're these little mesh type devices. They almost look like when you were a kid, we had these little toys, Chinese handcuffs, they used to call them. But it's basically just like a little woven mesh, and using really minimal incisions going in through the vessels in an outpatient setting, often like a cath lab or even in a hospital. The physician can open up those blocked arteries and push plaque out of the way. Sometimes they'll actually shave plaque out of the way, but things have really progressed a long way. There's even been some breakthroughs over the past few years with basically devices that can perform just like a bypass, but without having to do opening the leg up surgically. So, point is, diabetes may cause the underlying issues, but ignoring the signs and symptoms of PAD and critical limb ischemia and delaying treatment are the main reason that it's often too late to intervene. So again, I want to say, like I said earlier, time is tissue. The longer you wait, that damage may be irreversible. It's better to err on the side of being overly cautious in terms of seeking treatment, especially when you know you have risk factors. Do not delay. So this is why also better understanding of what's available to you can also help prevent the terrible consequences that we've talked about. But how do we prevent people from even getting to this point? The whole point of this message tonight is we have to be proactive. So testing for peripheral arterial disease is really quite simple. It can be done in a physician's office. It can be done in a hospital setting. But really, know this: anybody who's over the age of 50 who's diabetic should be tested for PAD once a year. And this is true even if you're a smoker, if you're a smoker and you're a diabetic or not. So really, age 50, if you are diabetic, you should go for this simple test. And it really is quite simple. There are a couple ways you can do it. And these are our recommendations from the American College of Cardiology and the American Heart Association. But you see some of these diagrams, some of the things that can be done. You see little, that device on the top of the screen there, that's a little Doppler device. They use it for neonatal type procedures just to listen. But you can also use that type of device in an office to listen to the blood flow to the legs and into the feet. And then there's a simple test called an ankle brachial index, which you can do simply by using a blood pressure cuff, measuring the blood pressure in the patient's arm and then in the ankle. You do it on both sides, and it's a really simple, easy to perform. You also have some devices that have emerged. One is simple, that all you have to do is put a probe on the toe and it hooks up to a computer, and it takes a couple minutes. So we've really come a long way in terms of what's available for testing. The main thing is it's not invasive, and they're easily accessible, and they're inexpensive, and bottom line is they're painless too. So why wouldn't you be proactive? And why would you wait for knowing your risk factors? Why would you wait for something bad to happen? Be proactive. People go to the dentist all the time. They go for regular checkups. So this is just part of it. So what can you do? Number one, if you have diabetes, do not deny your situation. That's the worst thing you can do. If you're pre-diabetic, consider yourself to be diabetic. I marvel at how over the years I've had patients who are on diabetes medications straight in the eye and say, well, I'm not diabetic. My doctor told me that I'm pre-diabetic. And to my answer to that is, well, listen, if you're pregnant, you can't be a little bit pregnant. You're either pregnant or you're not pregnant. So if you're pre-diabetic, consider yourself that you are diabetic too, and go from there. and start looking at lifestyle changes or being proactive. How do you do that? Diet, exercise, whether it's walking, stretching, yoga, resistance training, whatever you do, be active. Being sedentary is probably the worst thing you can do. But in terms of diet, how do you educate yourself? Well, read labels. Do things like learn about glycemic index, the hidden sugars in food. Understand carbohydrates and know the difference between good ones and bad ones. So, the whole point is that the more you take control of your situation, the better off you are. It's like you wouldn't turn your checkbook over to somebody and let them write checks out of your bank account. So why would you trust your health, to somebody, or just to, without being proactive in all of this? Next point, if you're a smoker, please quit. Hopefully you're not a smoker. And if you know somebody who's got diabetes and they're struggling, by all means, try and get them to not smoke. Every time somebody lights up a cigarette, the nicotine in the cigarette, in that smoke, basically causes a constriction of their arteries. It's like applying a tourniquet to your vessels in your body every time you light up. So when you've got somebody who's already got blockages in their arteries throughout their body, and now they're lighting up a cigarette, now they're tightening up those vessels even more. It's a recipe for disaster. You look at this picture of this young guy on this photo here. Guy's 40 years old. I mean, the guy should be in the prime of his life right now. And here you look at it. He's already had his chest opened up. He's already got renal failure from kidney disease, heart surgery, amputation. I mean, this is what happens. Our diabetic patients do not have just one thing wrong. They usually have about 6 or 7 things that go along with it. So you're really, really, you're really pushing your luck if you're not proactive. So again, I say it again, beware of the symptoms. Do not ignore them. Do a self-examination of your feet. So a couple years ago, I'll never forget this guy. I had a patient came into the emergency room. He was comatose, or not comatose. He was unconscious at this point. The rescue found him, and they brought him in, and his blood sugar was out of whack. We knew he had blockages. He had a severe infection in his foot. And so I had the operating room, we had to do an emergency surgery, and we had to restore blood flow with one of the other specialists. And when he finally started to come to about a day or two later, we started having a discussion. I said, I'm really sorry I had to meet you this way, and explained who I was and what we had to do. Excuse me. And learning what he had been doing at home. He had been ignoring symptoms that he had been having for a while, to the point that even his toes started to turn colors. So instead of sharing this, he hid it from his wife. He kept his foot in a sock at all times, and he decided that he would manage his diabetes by drinking root beer every day. So not a real good situation, not a good formula for success by any means. So you don't want to end up like that guy, and you certainly don't want to end up like this young guy here of age 40, who's basically in the final years of his life, if he makes it that far. What else to be aware of and to look for? Again, we talked about claudication, but besides claudication, if you're doing a foot inspection, check out your toes. And if you can't really see very well, ask somebody, one of your support system or caregivers, spouse, loved one, whoever, to take a look. See if there's been a loss of hair on your toes, on your feet, on your leg even. Are you, again, having pain in your legs at night when you're trying to sleep? Does it necessitate you having to sleep with your foot dangling? Or does it necessitate you walking the halls at night because you got so much pain in your legs? This is one of those other things that happens. A lot of times people with severe peripheral disease, the symptoms become worse at night. And so what they end up doing is they're up most of the night walking around trying to alleviate that pain. Discoloration, which we've touched on already, and you've seen some examples, or duskiness in the toes or in the foot. The foot becomes cool or cold to touch. Also, when you're doing your examination, what else should you be doing? Well, check in between the toes, especially if you've got neuropathy or if you lost some sensation in your feet. You know, it's you hear all the stories about somebody stepped on an object and they didn't realize it, but sometimes even in between the toes, you know, the knuckles from the adjacent toes can actually cause blistering or even wounds, especially if shoe gear has not been adequately inspected or adjusted over time. So, you know, checking in between the toes for sure. The tops, the bottoms, do it in the evening, do it in the morning, especially before you go to bed at night. So, what happens though if you're unable to see very well? Well, everybody nowadays carries one of these. Everybody's got a cell phone, okay? And we've all become quite adept at using our cameras for everything to document everything. And a few years back, people started walking around with these selfie sticks. So I started telling my patients, I said, listen, if you're unable to bend down and reach and or even use a mirror to take a look at your feet to see what's going on down there, why don't you get a healthy stick or a selfie stick, I should say. And I started dubbing it a healthy stick. But use your selfie stick and your cell phone and use that to take pictures and to examine the foot. You know, this is really a good benefit because even if you're using a mirror, you may not be able to remember exactly what you're seeing down there. So to be able to get down there and then to take pictures and then take a real close look or enlarge, that's certainly better than doing a quick transient evaluation with a mirror. And also, which I heard earlier this evening, you know, Monique and Dr. Horsley were both talking about the need for the team approach. This is so true. People with diabetes may not realize that they are among the sickest of the sick. And you've got to, again, I've said it multiple times, have regular checkups, stay on top of things. But if you are a diabetic, you really should be followed by a cardiologist. You really should be followed by a podiatrist, in addition to your primary care physician or endocrinologist. Just going to a podiatrist alone, studies have been done on this, will decrease your odds of having an amputation. And I understand in the Bahamas that you're limited with the number of podiatrists. I guess there may be 4 or 5 down there still. But listen, that's besides the point. You know, don't take things to chance. Just be a good patient. Get in to see my colleagues down there. They're obviously here to help. This is why they're doing this type of a program. Nobody forces them to do this. This is out of their sense of duty to you know your countrymen, your fellow citizens, your friends, your family, people that you love. Also, proper fitting shoes. Do not neglect this. This is something that is really amazing. The little clip that Monique showed at the very start tonight, talking about how even a pregnant woman's feet will grow during pregnancy. You know, people's feet change. People's size of their feet change over time. And if you ask people, when's the last time you measured your feet to make sure you have the proper size? It's very rare. So people tend to try and they try and fit 10 pounds of bologna into a 5-pound bag sometimes. You just can't do that. And this can really cause a problem, especially if you've got loss of sensation and you're it's a sure way to rub up blisters or worse. So really use that technology. Doesn't have to be high tech, but we have evolved now too. You know, we're on the verge of some pretty neat things coming out. Yeah, that old reliable mirror, that's one way to look, you know, and even if you don't have a mirror, still reach down, see if you feel anything. Something doesn't look right. Be on the lookout, but use your cell phones, use those selfie sticks or healthy sticks. And even now with telemedicine emerging, there are all sorts of opportunities to be seen by medical professionals without even having to get to an office or you know, hopefully not to a hospital. One last little tidbit of what to be aware of if you have diabetes, and this is one of those things you may not always hear about, but that burning, numbness, tingling, like I mentioned earlier, is not just a symptom of neuropathy. It can be a symptom of advanced PAD, but Look for breaks in the skin, blisters, and redness. In particular, redness and swelling in the foot, like you see here, that happens without any real apparent injury. Um, I've had patients who literally have gone to bed the night before. They wake up the following day and their foot is red hot and swollen. And the scenario is, they'll present to the emergency room or go to their doctor, and they're prescribed an antibiotic and sent home. In reality, this may not necessarily be peripheral arterial disease. What this can be is a sign of an advanced form of neuropathy, and it leads to a condition called a Charcot deformity, and that's spelled Charcot. A Charcot deformity has to be recognized early on. If you don't catch it, what will happen is the foot will undergo, and what actually is going on is that the foot is undergoing spontaneous fractures that are often not felt by the individual. So what happens is the patient's walking around with fractures in their feet and they don't realize it, and the damage is being done with every step. And what happens then over time is that foot, the arch in the foot collapses, and now you've got a permanent deformity of the foot. And now you've got pressure points on the bottom of the foot where there shouldn't be any. And this leads to ulcerations often on the side or on the bottom and the side of the foot, like you see on that photo down there with some, it looks like there's some white stuff around it. There's felt around that wound. But the point is that this is ultimately the pathway to amputation. So, you've got to check your feet for bony prominences. And again, that sudden swelling with increased warmth, especially without any real prior injury. So with that, I'd like to answer any questions or even have my esteemed colleagues join in with answering the questions. And I'm happy to spend some more time with you here this evening. And if in the meantime, if you're interested too, you can learn more about the Save a Leg, Save a Life Foundation. I'm hoping that we're going to do some more work down in we're working on doing some other work in the Caribbean now too. So we think we figured out a way to formalize some type of relationship. So what you're doing here, we may be able to do some type of a co-op or some type of partnership in all this. So that'd be great. So anyway, if anybody has any questions, I'm happy to answer.
Awesome. Thank you, Dr. Bell. That was a really, really comprehensive and inspiring presentation. We appreciate that. And we're going to just encourage everybody to put their questions in the chat. And I'm going to begin. I have a question from before, so we're going to start with that. And just if you have your chance, anybody have a question, you can put it in the chat or you can just raise your hands and then we'll be able to recognize you. Dr. Bell, you mentioned the importance of persons being proactive rather than reactive. And I think a lot of times as patients, especially here in the Bahamas, it's changing a little bit, I feel, but especially here, our patients are pretty much, for the most part, go by what the health professionals tell them. They don't tend to rock the boat too much. Probably the younger persons, like everywhere else in the world, but for the older persons, they're pretty much will go by whatever the doctors tell them or the nurse or whoever it is that, or even family members or old wives' tales and all this stuff. So what are some practical ways that persons can be more proactive in this way, that to really, really just pay attention to what's going on with their feet and to ask questions and stuff like that?
That's a great question, Monique. I think, we live in the information age now. The information and resources that we have on our phones it's mind-blowing. We have artificial intelligence now, but we've got these resources that, I'll date myself. When I was a kid, if you had to write a paper or something, you'd have to go to the library and you'd have to go through the card catalog and you have to start pulling journals and looking for books and all sorts of references. the things now you can do in 10 minutes off your phone. And so, if somebody has got diabetes, the last thing they should be doing is living in fear. What they really should do is take advantage of all the information that's out there. So much of it is presented in ways so that it's not intimidating to people too. You start with small steps, you start with small changes, and you make those little changes, and now you've achieved something, and then you keep going. But to simply live in fear and say, well, it's a foregone conclusion, it's been in my family, I'm probably going to end up dying from it, or I'm going to have my legs amputated. No, it's not necessary. Again, educate yourself about what to look for, but knowing how to manage your diabetes. I'm going to get on my soapbox for one more time here. One of the things that really frustrates me, kind of Dr. Horsley was touching on this a little bit earlier, but I look at television commercials for medications for your diabetes and how they portray diabetes. It's almost like it's a big party. It's like, all I got to do is take this pill and I can get my A1C down. And that means now I can go have another cheeseburger and I can just go have fun on that cruise ship or whatever it is. Hey, and it's like, no, this is the wrong message. It's like you're entering a world of pain, basically, if you choose to ignore this. And the thing is, a lot of this stuff is so preventable. And in so many ways, some of the real drastic things anyway, again, working that team approach, follow up with your podiatrist, but don't, living in fear is not an excuse. It's again, hoping is not a strategy. Hope is not a strategy. That's just, you're just adding to your risk factors by behaving that way.
Awesome. I just want to also say that, I love that you said the first thing is a mindset change. And that is what we're all about on this program, is that we providing persons with not only information, but skills and a change in attitudes so that persons could make that decision, and also resources. They know that, okay, I had a patient like today. I was wondering if Dr. Horsey was by me today because I had a diabetic and his blood sugar was 349. And Dr. Horsey just said 350. And I was like, Dr. Horsey must was in the office today.
Right.
And so, but persons don't, we want persons to know that when you see these things, that is not okay. That's not a blood sugar for you to just say, oh, I didn't take my medication today, and just continue on. A mindset change, that is what Feet4Life is all about. We want to give you the information so that you can actually have that information to make the best decision for yourself and your family. We want to be able to give you the resources. You can call me up. You can call Dr. Horsley. You can get Dr. Bell. You can get anyone on this line. We have many persons. We have nurses, physical therapists, no matter who it is. In fact, a patient called me today. She was not clear on what her primary doctor wanted her to do, and she called to have a conversation about what are her options and all this stuff. I was able to help her to kind of work through that and refer her and just basically help. She knew exactly what she needed to do, but she just needed a sounding board to be able to make that decision. But it's about a mindset. It's about the information, having access to information, having access to resources. And that is what we want to do or to provide in this community.
Yeah, and you know what, Monique, what you've created here too is people need to know you don't have to go it alone either. That's the thing. It's what better resource than to have professional people like yourselves and other people in the community all working on this problem, and not just saying, oh, okay, it'll work itself out. No, it's those resources, being a resource for each other, and just that mindset is so important. It's like, you can worry about things or you can do something. And unfortunately, a lot of times we worry about things that don't even happen. We create these scenarios in our minds. So live your life like, today's your last day. Just Be, if you want to be happy, be happy. Don't choose to be miserable. If you want to be healthy, choose to be healthy. Don't just sit around and waste another day. It's just not, there's no guarantees, but you want to have that quality of life. You want to give it your best shot, and you want to be there for your friends, your family. And then at the end of the day, at least you've done your part. So
I agree, Dr. Bell. My personal experience is my mother actually recently passed or died in August of this year, and she was a diabetic for a very, very long time. And because of the complications of diabetes, that is why her life was cut short at 76. And I look at that and I say, wow. I mean, I've always known that I am at risk for diabetes, and I've always worked hard to not go down that road. And I continue to do that, and I I don't know what's going to happen in the future, but I know one thing: I'm going to be fighting it out, doing my very best to not go that way, and or to not have the challenges that she had. So we just need to do our best. I'm not perfect. I struggle just like a lot of people struggle with weight and with other issues, but once we make that decision, this is an excellent time to do it. I'm not a real big fan of New Year's resolutions, but this is an excellent time to make a choice to live healthy, like Dr. Bell says, to make that choice to do what it is that you need to do. And that is an encouragement to me as well. So I just want to say, let us all take heed and listen. So we have one question in the chat. It says, while I understand and appreciate the benefits offered in this presentation, many people across our family islands are concerned about the controversial toxins that are allegedly added to prescription medications. Despite their worst fears, they would rather adhere to good old bush medicine. Please elaborate on that a little bit. So bush medicine is where where it's very common and very popular in the Bahamas. It's our history. It's our legacy, really. But there is a lot of good in bush medicine. That's my personal view. All the majority of medications, even the traditional medications, a lot of them started with a herbal or plant-based component that was improved or utilized in labs and all that kind of stuff like that. So we definitely know that there is healing in the bush, and we know from the Bible that says, the healing of the nation is in the leaves of the trees. So and that is what they're for. My only concern or caution about the bush medicine is how much or what quantity of it that we're taking. And I can say that even from the standpoint of the Ministry of Health and Wellness, there is a move toward looking at the bush medicine and how we can either quantify the content of these herbs and bushes and stuff like that. Persons, you need to just be careful about what it is you're taking and how you're taking it. The caution is that bush should not be boiled. They should be steeped, not boiled in a roving boil on the stove. You put the leaves in you boil the water, pot of water or whatever it is, and you put the leaves in that water and you let it steep. And then after that, that is how you drink the bush, rather than boiling it. And sometimes you boil it and it comes out a really, really dark color, and that's the concentration of the medication in that bush. So we want to caution persons to know that you can actually damage your kidneys, your liver, and all of this if you take too much of the bush or use it in too high of a concentration. So that is the only way. I think persons who are seeing a medical doctor, they should let them know that they're doing that, and so that they can be monitored, and then they should monitor themselves. Take your blood sugar just like if you took insulin or if you took Januvia or whatever medication that you were going to take. You were going to take your blood sugar. You were going to watch what you eat. You were going to do all these things. So do the same thing. Be responsible and do that. That is how you build knowledge and all this, rather than it's just anecdotal. You know, you boil your bush for 5 minutes, I boil my bush for 10 minutes. You know, it has to be a way that we can quantify that and be able to have it um better, um so that persons can be safer. And I see Ms. Stewart is saying also that the bush is not scientifically tested. So that is another reason why persons have to be careful or not exceed that the use of that bush, because you don't know the concentration. Like when you get an aspirin, you know that's 81 milligrams. You know that's how much medication is in that tablet of aspirin. But a lot of the work has not been done for the bush. And so we have to be careful with that. And that is one of the reasons why persons would have to do that. So are there any other questions? We have a few minutes left. So if anybody else have any more questions, we just want to recognize where persons are coming from. Of course, we have persons from New Providence. We have persons from Bimini, Grand Bahama. We even have someone from St. Lucia, Castries in St. Lucia. We have persons, of course, from Bimini. I see Andros. I see, I don't see Cat Island. Of course, Dr. Horsley is in, I think he's in Detroit.
Yeah.
And so we definitely have, and then Dr. Bell is from Florida. So we definitely have a wide group of persons here tonight. So I want to just thank, do we have any other questions? I don't see any more in the chat. Okay, so we're gonna begin our closing. Okay, wait, we see. Okay, yes, we have another question here that's asking if we have a copy of the recording will be available. Yes, the recording will be uploaded to our YouTube channel, which is Feet, F-E-E-T, the number 4, Life 242. And you can go there probably, I would say by the weekend, you should be able to see the video there. So we're gonna upload the video there so persons can go and see it again. And then Dr. Horsley has placed in the chat again the information about the book. See My Toe Can't Go at sales.bookbaby.com. So you can just copy that out of the chat and you can go to that website. I already been, and it's very, very simple and very easy to do. So just go to that website and you'll be able to get your copy. I'm gonna think about that a little bit more, Dr. Horsley. I think we need to do something with the children with that book. And
Right.
we could definitely plan something that we can look into.
Okay.
All right. So if we have no other questions, we're gonna end our meeting tonight. We just want to say a special thank you to Dr. Bell, who graced us with his presence and his
Oh,
presentation, a wonderful
excellent.
presentation. In the chat, we have many commendations and thank yous to you, Dr. Bell. And we're very, very happy that you're here, and we're looking forward to you coming to visit again. You know, we're in the process of planning our next Barry trip. They're coming on the 2nd to the 10th of March of this new year. And so we're looking forward, possibly, possibly, we'll keep our fingers crossed. Maybe you can join us. But we'll definitely, those on the call, you'll hear a lot more about it in a little while. So we will definitely be looking forward to that again. And Dr. Horsley, it's always a pleasure to see you. Thank you so much for the information on the book. And we're very, very pleased. We will definitely go and look for it and support the project. And I think it's very, very good. And the charts in the back for the foot screening, as well as for the blood sugar, blood pressure, and all of that, the logging.
Right.
It's a very good addition to the book, and I think that will empower a lot of persons to use it.
Excellent.
Awesome.
Great
So we
evening.
are, go ahead.
That's a great evening. It was really
Awesome.
good. Yeah. I
All right.
enjoyed-
Well, thank you everyone for coming. We're gonna ask Mr. Elder Roll. I don't see him. Is he still on? I'm just gonna just say a short prayer. I don't see him. All right, we're going to close with a word of prayer. Our next meeting is actually on February. We're planning another exciting meeting for you, and it's on the 8th of February. And so we're very, very excited. We'll get that information to you as soon as possible so that you can plan. Tonight was a really busy night, so we're very pleased that all of you showed up, and we had a good turnout for Dr. Bell, and the information was just very inspiring, and we're going to have it available for you on the weekend. Thank you very much. Let's have a word of prayer as we close. Gracious and loving Lord, thank you so much for sparing our lives to see this day. Thank you for bringing us here safely and allowing us to have this meeting and spend this time discussing how we can help to save our own legs and our lives. Give us the strength, oh Lord, and give us the courage to seek and find the information that we need, that we can empower ourselves to help and to prevent these complications of diabetes. We ask that you would bless us, guide us, and keep us. Help every one of us as we head in our separate ways tonight. Bless us, guide us, and keep us. In your holy name I pray. Amen. Amen. Good night. Good night, everyone. Thank you again, Dr. Bell. Always a pleasure.
Yep. All
All
right.
Thank
right.
you,
Good
Monique.
night. Okay.
Good.
Great seeing you all.
Oh,
Thank
my
Good
you.
seeing you
pleasure.
too.
All
Okay.
right, buddy.
Hope to see you all again soon. Bye-bye
All
now.
Awesome.
right.
Thank
All
you.
right.
Good evening, Dr. Bain. I see Dr. Bain is on. I see Dr. Gomez was in. I see Nurse Stewart. Awesome. Thank you so much. Oh my goodness. Thank you all for attending and continue to share. A lot of people need this information. And so we're very happy that you are able to join us and to be able to attend.